If you see that blood, no, they are normal blood. You might just see mucus, small catarrh with small blood. That might be the first sign of labor. But whether you are in labor or whether you are at home, and suddenly you see a gush of blood, sometimes coming in cloth, whether there is pain or no pain, rush to the hospital. It is not a time to wait for your husband to come back from work. You must go to the hospital immediately. Another one that is so bad is when a woman that has previous CS, MFG CS before, maybe once or twice, might go to a maternity or somewhere where she will be given hot injection. That hot injection can rupture the uterus. That's also another way you can see bleeding. But most time, yes, it can happen at home. The uterus can rupture on its own without labor. But commonly, what we encounter in uterine rupture is that the woman went to somewhere, was taking delivery, and suddenly bleeding started. That one is uterine rupture. It can also give us bleeding. Now, if there is a miscarriage, sometime 1 month or 2 months, I'm not saying it's so good, but that one is not as bad as a woman losing the baby at 8 months or 9 months when she must have gotten in one. If she loses her baby in 1 month, I'm not saying it's good, but at that time, most people doesn't even know they are pregnant. She herself is not even convinced within herself that she is pregnant. In fact, there are so many pregnant women that are pregnant for 3 months that are still not convinced they are pregnant, because that time the baby has not started kicking, nothing is happening. Sometimes they are just vomiting. That one might be acceptable, because most of the cause of miscarriage at that time somehow may not be able to be prevented. It's not preventable. But the one that happened at 8 months, 9 months, stillbirth, somehow it is a death that can be prevented. And there is nothing as bad as life ending at birth. You see that this life just started and suddenly the life ends. I don't know if you understand. It doesn't talk good about any facility. So please, even if you don't know anything, know that as we are getting closer to this thing, there are some things you might find. There are some things that might happen and the woman will run here and will play with it. Some of them might just have abdominal pain and they will call and tell you, especially in the cases that we are in labor. In fact, some of them will be working. By the time you see them coming into this place, another person is bringing the full flask. Somebody is bringing the delivery requirement, and she will be working like and by the time they reach here, you go and examine. She has not even started dilating. If you ask very well, you now realize that she has suspensory ligament tense. If you give paracetamol or buscopan, she will slip off. Tomorrow you tell her to start going. Forget about this thing. You come another day. I don't need to answer. Because if you are not careful, you will start a war when there is no war. You will start examining her. Hey, the husband will come and ask you, doctor, how far? Is he not 2 cm? Or say, hey, 2 cm since stay. The man will go after 6 hours. You come and tell the man another 2 cm. The truth is that the woman was not even in labor. So that thing can stay for like 1 week in 2 cm. I don't even answer. Before you know it, people will start counting. She has been in labor for the past 3 days. It's not progressing. In fact, the one we delivered yesterday, the woman called me and said, Dr. Chere, somebody pinned this baby. I say, yes, I agree with you. That person pinned the vagina. I will come through the other side now. I don't even understand. Say, that person, I don't even understand. Say, I never choose a shimpi. Why may she give her? I will come through the other side. And she said, okay, that one will not go through. They didn't close it. I said, no, they didn't know the road. I'm the one that will open the road there now. Said, because there was no road there before. If they say they spiritually closed that road, because that woman had been, in fact, the truth is that she had a baby that was 5 kg. Very big baby. And the baby was not even showing any sign of coming out. The head is not even engaged. And she's even a previous car. By the time I came, I said, Madam, you see, we have to bring out this baby. Obaba Road. We are just playing here. Obaba Road. She now said me, no. Now, she's waiting for her Onyamuma to come. The prophet to come. That Nas make it when the woman's now blood somewhere. I said, this is a thing of the spirit now. This woman don't need to be here. I don't know if you understand. She can pray from wherever she is. The prayer can work here. Let me be doing my own in the theater. Let this woman be in her temple and be fired so that everything can work. See, once they have gone to close this place, also yes, you see, I will follow another route where they also doesn't mean they didn't close that place. I said they cannot close it because there was no road there before. And we create a road there and close it back. And as God may have it, the baby was okay. The mother was fine. In fact, the baby is not even up to 24 hours. The baby was 24 hours. It was yesterday in the midnight, early this morning. I don't even answer. It was around 12:01 in the morning. Because she had been in labor somewhere, laboring. I don't know if you understand. So you know this slogan in the Catholic. I don't know if you understand. The thing say, Ave Pt.3 Jesu. Onye jisike. Onye bogide kwushiri. One day I don't know if you understand. So when the woman gets in there, labor. I don't know what get pushing. And it's time for me to help her. I'll be one day. Am I not the brother again? I'm the brother in the hospital. We might not be the brother in the Lord. We might not be the brother at all. But we are brother in the hospital. So the woman are pushing. I don't need to understand. It was time to help her. But when a woman is in that situation, you are thinking, can the baby pass through? Can the baby not pass through? The first thing for you to do is just keep on monitoring the fetal heart of the baby. If once the fetal heart is okay, everything is fine. Allow her. When the time comes, she is the one that will call you to come and operate. For the fact that the head of the baby has not actually gotten to that place, the baby doesn't usually die. Mana, if you have this issue where you are contemplating between placenta abruptio and placenta previa, it is not a time of trying to play games with the woman. You must give her the instruction. This thing has to be done now, or there might be an issue. And by the time you talk to a learned woman, well, usually they will understand. So the issue of pain may be neither here nor there. There are so many things that happen in pregnancy. In fact, some women will just smile. They will smile. Then they will start having urine production. That one might be normal for them. It's stress incontinence. There are so many things that happen. In fact, a pregnant woman will tell you that she wants to eat rice. You will run and go and buy that rice. She will change her mind, not see yam. I don't know if you understand. By the time you get the yam, she says unripe plantain. She can change her desire for food 5 times in 1 minute. That is a psychological problem in pregnancy. It's a mental problem, but we don't usually count it. It's an issue. I don't even. One day I went to the Roban store. You know Roban store? I went there to buy Sprite. And that Sprite is only that place I can see that type of Sprite. Is this Sprite that used to stay in can? Not the bottle Sprite. That can Sprite. I bought the can Sprite. I brought the can Sprite here. I sent someone to buy me meat pie so that I will use to drink this Sprite. One pregnant woman came and insisted that all that Sprite organ. I gave her money to buy another one. She said, "Is this one that she wants to drink?" We were still talking. The woman was like crying. No, this Sprite organ. I want to drink this. I was thinking she's just playing with me. I said, "Okay, take." She opened the Sprite and started drinking. And the person that was there was seeing it. It might be this woman. I say it's a psychological problem in pregnancy. They can do anything. I don't know if you understand. The husband can go to work and come back. The woman will start crying. Nothing happened. So many things can be taken for granted in pregnancy, actually. But you see this issue of bleeding, once it occurs, whether in the beginning of the pregnancy or in the end of the pregnancy, should be taken seriously. It's not the one to be played with.